We have a intake services department. We run a 24-hour helpline for inbound callers. A lot of what admissions does is admissions into our facilities. Also, about a lot of what they do is basically assisting callers into outside resources. We have referrals for treatment. We have referrals for outpatient. We have all different types of calls. The idea for the team is to essentially, people call in, they have questions. A lot of the time it's not really something that would be relevant for a placement at Lakeview, and that's okay. We're here to help. So we answer questions. We help people with local resources. We help them find, whatever their need for themselves, their loved one. We want to make sure we get them and point them in the right direction. About 80%, honestly, of our calls don't get placed at Lakeview, and it's really more so we help them with local resources, or we refer to referral partners, or, just basically sometimes people just need to talk. Like, people will call in and have a question about, recovery or a loved one, and it's basically just informational. They just need somebody to talk to, and, we're there to help them.
That's one of the things that's a real strength with our admissions department. When people are reaching out for help, that initial call is very difficult, and it can be intimidating, and people are embarrassed or in a lot of trouble. And when they reach out and get one of us, we can relate to them. We can empathize with what they're going through, because each of us has made that call in the past. So that puts people at ease. And when they're sharing their story with us, when they're telling us what's going on and why they're reaching out for help, we never really hear anything that we haven't done ourselves. We can really let them know that there isn't going to be any judgment involved, because we've been there, we've gone through it, we've done those things ourselves, and we're not there to judge them, we're there to help them. And that really puts people at ease. Well, the range of questions that people who are looking for help for their loved ones it's a pretty wide range. It's everything from, the concern about the facility itself. Is it a medical facility? So we can, share with them it's a medical detox, there's 24-hour nursing, that kind of thing. Another thing that they're interested in is, is there any support for the family? And that gives us an opportunity to talk about the clinical program a little bit, the family workshop, that kind of thing. Another thing that family is interested in is, how do we get somebody to agree to go to treatment? Mm-hmm. That's a big, big question that we get, because they know their family member has a problem, but the family member is refusing to get treatment, is refusing to admit that they have a problem. Mm-hmm. And because, once again, we've all been through it, we can look at it from both sides. We look at it from the mind of the person with the substance abuse issue, mm-hmm. the way we used to think about it, mm-hmm. and the way the family is, where they see somebody who's in trouble, mm-hmm. sick, in danger, and needs help. And so we can counsel families on ways that are effective to get people to agree to go to treatment. And that's one of the big things that we do in the admissions department.
You have to think about the nature of the concern, right? A lot of that stuff's just fear-based. They're nervous about going to treatment. Their job, most likely they will lose if they don't seek help. Their family, most likely they will lose if they don't seek help. It's just difficult for people to, it's easy to be nervous and throw a bunch of things in front of, the actual need to go to treatment. So I think that's kind of what Paul was referring to in regards to a lot of the people on the phone have been there. So we've already been through all this stuff in our own lives. Like, I had a job before I went to rehab, and I had an active household, a family before I went to rehab, and I had all these issues. None of them are really relevant, like why you shouldn't come. It's just fear and helping the person feel more comfortable with it. I mean, anything that you're concerned about losing before you come to treatment, most likely you will lose if you don't go to treatment. We communicate with employers directly very frequently. We've been very, we've done a very good job with, FMLA and medical leave. And you remember, a lot of this stuff is protected ADA, these type of illnesses and ailments. So we've been very successful in bringing people into treatment and solving problems. One of the things that we don't want to do when we bring somebody in is cause a new problem. Mm-hmm. The last thing we want to do is have the admission into treatment create another issue, like you lose your job or you lose your house or you lose your car. We're supposed to be solving problems. We don't want to make it worse. And so we can do a lot of that prior to the admission. Person has concerns. Okay, well, job, family, we'll go through with them. What do you need us to do here? What do you need us to do here? Do we need to get short-term disability paperwork, or do I need to talk to your wife, or do we need to figure out how you're going to, pay your bills while you're here? And we do all that stuff for people before they come in. Make them feel more comfortable about coming in. At the end of the day, they still need to come to treatment. It's just that I totally understand the concern. And that's the thing, we understand that what it really is, what's behind it, and deal with it appropriately. You can't tell someone that has a concern when they're coming into treatment that their concern is not valid. You can't invalidate, you have to validate this stuff, because in that person's mind, these are legitimate concerns. So rather than say, that's not really a good reason, say, okay, let's present, here, I'm validating your concern and I'm presenting a solution. And then once we do all of that, the people feel more comfortable, they come in and they get better.
Yes, our number is 24 hours a day, 7 days a week. We're always there. It's 866-887-0142, and there's lots of information on our website, lakeviewhealth.com.